Madam President.
Senator from Nevada.
Madam President, Madam President, excuse me, Mr. President.
It's happened to me before, too. It's okay.
I apologize.
No
Mr.
worries.
President, I am joining my colleagues today because Nevada's health care and Americans' health care, it really is not up for negotiation. And on Wednesday, I want to recognize this. Senate Republicans released their budget plan to pay for President Trump's billionaire tax cuts. You've heard everybody talking about that. We've been on the floor. This is so important for the American public to understand what's at stake, because really we can't let them fool you with some bureaucratic language or to make them seem less devastating than these impacts really are, or to use some sort of math gimmick. Because here are the facts, and let me just say, April 3rd, 2025, we just received from the Joint Committee on Taxation that shows that President Trump and his Republican followers in the Senate really want to add almost $7 trillion to our national debt. The Republican plan to extend the 27 Trump tax law will cost $5.5 trillion, including interest, and the budget resolution Senate Republicans introduced this week allocates an additional $1.5 trillion for tax breaks to be crafted by the Finance Committee Republicans and the Trump administration. This brings the total cost for over 10 years of the Republican tax plan to about $7 trillion, $7 trillion in deficit and debt. And they are doing this to give tax cuts to billionaires. And in order to pay for it, one of the things, and you're hearing us talk about this, is they want to slash Medicaid in this country by almost $1 trillion. You've heard this term, $880 billion, because that's what the House has sent to their committee to say we need to find some way to pay for these $7 trillion that in tax cuts that we want to give to billionaires. Now, Nevadans and so many across the country are being told these cuts are going to come from cracking down on waste, fraud, and abuse in Medicaid. Well, that would be great if it were true. Let me just put a fine print on this. I'm all for getting rid of waste, fraud, and abuse within government programs. And I know that many states, and actually all states, including the Attorney General's office in the state of Nevada, they actually have a Medicaid fraud unit that goes after that fraud, waste that we see across the country. Every state has one. But here's the simple truth. We are not going to find $880 billion in pay-fors by only cutting waste, fraud, and abuse in Medicaid. To shrink this essential program down by nearly $1 trillion, President Trump and his Republican allies in Congress, they actually have to gut Medicaid. There's no other way around it. That's what they have to do, and that's not just a talking point from the Democrats. The nonpartisan Congressional Budget Office, their analysis confirmed that Republicans would have to make the largest cuts in Medicaid history to meet their budget's $880 billion target. Now, here's what I know, and you're hearing from all of our colleagues that tonight, and you will hear this as we go into the votes that the Republicans want to take on this. I don't care whether you're from a red state, blue state, you live in an urban area, rural area, Medicaid cuts to pay for billionaire tax cuts would hit everyone hard. It would be devastating. And nearly 800,000 people in Nevada would be devastated by this because they depend on Medicaid to keep themselves and their families healthy. This includes 1 in 6 adults, 3 in 8 children, 4 in 7 nursing home residents, and 1/3 of people with disabilities. I also know that 66% of adults in Nevada who benefit from Medicaid, they work for a living. And 43% of our births are covered by Medicaid. In Nevada, 17,600 Medicaid enrollees used home and community-based services and long-term services to support them. These are seniors, these are people with disabilities. And nearly 40% of all children in Nevada are covered by Medicaid and CHIP. And you heard my colleague from Rhode Island say this, and I also want to dispel this notion that people on Medicaid are somehow lazy and they don't want to work and they're just somehow milking the system. Let me be very clear, nearly half of all Nevada Medicaid enrollees, that's 380,000 people, are people with jobs and their dependents. Now, I want to put a fine point on this because I have to just call this out. This is just a crazy notion because I've met these families. I've met a woman, she and her husband are working, they're both working full time. Their daughter has a rare disease. Without Medicaid, they would not be able to afford the medication and the healthcare, access to healthcare that she needs. I have visited in my state clinics, FQHCs, clinics, federally qualified healthcare centers in the north and the south. I was in the northern Nevada one just 3 weeks ago. And I was looking at the individuals that were coming in for care, and I asked them, how would you be impacted by Medicaid? Not only would it devastate this health center, I said, who are these people that are coming to you? You know who they are? They're people that are working at Amazon. They're people that are working at Amazon and Walmart that have to get Medicaid because the billionaire owners of these organizations don't care enough to provide them health care. This is outrageous, but these are the people that we are talking about. And let me just say, last month I met with a group of obstetricians from northern Nevada. Medicaid is the largest payer for maternity services in my state. In 2023, there were 13,206 babies and their mothers who had access to essential health care. Nevada Medicaid does postpartum coverage up to 12 months thanks to the American Rescue Plan. And now the Republicans and Donald Trump want to take it all away. I know I am not the only state that is dealing with this, and I will tell you, and it's some of my colleagues I know, and I've talked to them, whether you're Republican or Democrat, we have talked about this. It's devastating for our urban areas. It would devastate my rural communities and every rural community across this country. If you live in a rural community in my state, you have very little access to health care. So you want to keep those clinics open. Because if you don't, then you're driving 4 hours just to get your health care somewhere, if you have the ability to get there and drive there. And so I know it's not unique, and my hope is that my colleagues and my Republican colleagues who care like I do, and I know they do, about their constituents, we are going to address this issue and we're going to work together so we can protect Medicaid. But, Mr. President, I would like the opportunity to engage in a colloquy with one of my colleagues who is here today from Michigan.
Without objection.
Thank you. Because the senator from Michigan, Senator Slotkin, I know, like my state, they call it a swing state. It's a swing state. We have voters that we represent that are Republicans, Democrats, independents, and it really isn't about your party. It is about health care and access to health care in this country. And so for my colleague from Michigan, I am curious what she is seeing and the impact that the Medicaid cuts that we are talking about would have to your constituents, the people that you represent in Michigan.
Thank you, Senator, and thank you, Mr. President. I mean, I think what we're all here talking about into the dead of night is this idea of who we want to be as a nation when it comes to providing health care. Do we believe that the greatest country in the world should be able to treat the people who need help in our country, or are we okay with the poorest among us, the weakest among us, those who are disabled, those who are elderly, those who are children, just not having access to care? And as you said, when you look around at the math, right? This isn't a political statement. The math of needing to find $880 billion with a B, the math just doesn't work without gutting Medicaid. And I think it's important to understand, at least in my state, that this isn't just about people who have Medicaid as their primary insurance, right? We have 10 million people in Michigan, 2.6 million people are on Medicaid. The vast majority are children, right? People who can't live up to work requirements, people who just happen to be, young people who happen to be born where they were born. 37% of all our births in Michigan are handled and covered by Medicaid, and 2 out of every 3 nursing home elderly are covered by Medicaid. So it's not just about the people who are receiving direct care, it's about what Medicaid reimburses and funds. The idea that 65% of our nursing homes could potentially go under if they don't get this funding. The idea that our rural hospitals, from Hillsdale to Marquette, Michigan, have come to see me and they say, look, we're not Democrats, we are conservative people, but if you take away this reimbursement, we will collapse. They're already suffering after COVID, they're barely hanging on. So access to rural hospitals is something we're deeply, deeply worried about. I think the bigger question is, who do we believe we are, and do we have a commitment to serve and protect and provide basic health care to people in our states? Now, you mentioned this, but I think it's important to realize that with a number that big, we're not just talking about Medicaid. There's real risk of Medicare Part D being touched, the prescription drug piece of that, and the Affordable Care Act, which so many people depend on, the many, many people being cut off from that at the end of the year. The math just doesn't work. And so what we're really talking about is, in the state of Michigan, in the United States, the potential for either people to lose their coverage or to have the price of their coverage go up. Because everyone talking about these Medicaid cuts back home has also mentioned that, by the way, if we don't get the Medicaid reimbursement at our hospital, I'm just going to charge more to the people who have insurance. There's going to be more people in my ER. I'm going to have to pass that expensive price off to customers who do have health insurance. So it's just important to understand the full spectrum of what we're talking about here. Now, I'm sure you've heard a ton of personal stories, right? It's important to understand we're giving a talk on the Senate floor, we're talking about numbers, but at the end of the day, this is human beings. And I'm sure your phones are flooded, as mine are, with people who want to tell their personal stories. And I will say, for me, it feels like Groundhog's Day, because I decided to run in 2018 for the very issue of health care, because I happened to live through my mother getting stage 4 ovarian cancer without having insurance. She had no insurance. And that first month of that terminal diagnosis, where you're desperate to get her tests and coverage and some kind of emergency surgery, you're using your credit cards, you're doing whatever you can while you're just feeling completely lost that you know your mother is going to die. That feeling is the worst feeling I've ever experienced, and it's what we're proposing to millions of additional Americans by the end of this year. So I'm sure you've heard a lot of personal stories on your phones. I don't know if you want to walk through a couple of those stories, but I think it's important to make it a human issue, not just a numbers issue.
And that's right. And I think my colleague from Michigan, because it's true. I mean, I can tell you, in February, I spoke with Madison from Nevada. She has stiff person syndrome. This is a disease that impacts all her muscles and her breathing, and she has to be on a ventilator 7 times. She wouldn't be here today without Medicaid, which provides her with home health care. And Madison's sister, Tricia, was with her that day when she had to deal with such, and this is trauma. This is such, healthcare is trauma in somebody's life. If Madison's Medicaid coverage ends, she would have to go live with her sister and depend on her for care. She'd be forced to move away from her community and her whole life. Madison needs really Medicaid to live her life to the fullest. And like my colleague says from Michigan, these are real people that will be impacted. And I know she's seeing the same. I do want to pose to her this thought, though, of It's not just the individuals. We know there's real life impact, and we see it. We hear it in our offices. We are getting those calls. We're meeting with individuals. We know them. We know them. They're our neighbors or our friends. We know them when we're home. Here's the other thing people forget, though. I know in Nevada, we already don't have enough providers in Medicaid. We don't have enough providers in the program to begin with. And expanding the number of healthcare providers in Nevada, it really has been a priority of mine, and that's why I am leading legislation, bipartisan legislation, with my colleague, Senator Cassidy from Louisiana, to support graduate medical education programs. But here's the deal. If Medicaid funding in Nevada is cut, not only will those rural health clinics close that I talked about, but here's the thing people forget. We would have fewer providers, because they would be incentivized they would not be incentivized to come to my state and treat patients. They're going to figure out where they can go and still survive. Remember, our providers have to still survive and make a living, and they want to treat patients. And so we are going to have a provider issue in my state. And I don't know if that is an issue for Michigan, but it is something that goes hand in hand with these Medicaid cuts, because I hear from my providers as well.
We talked about rural hospitals. I think, again, even if you're not on Medicaid, you've never signed up, you've never been at a low point in your life where you've needed a bridge, you've never had a child with a disability, you've just never touched the system, I guarantee you the hospitals that you depend on, the clinics that you depend on, the nursing homes that you depend on for your mom, your dad, are dependent on Medicaid. I guarantee it. And what we're hearing from our rural hospitals is, look, we're the only hospital in 3 hours where you can get care. If we go, where do our people go? Where do we tell them to go? If you're delivering a baby and you have to come off the Upper Peninsula into the Lower Peninsula of Michigan, there is just no way that we can function that way. So it's not just about as you say, individuals, although those stories are striking, it is about access to care for everybody. I was talking to a doctor from the Lansing Carefree Medical Clinic. It's completely Medicaid covered. It is the folks who are left out of the system, he will just close. I mean, we'll have clinics just close. So I think we're talking about something that, again, comes to the heart of like who we are as a community. I will also just say, I think it's important to put a warning label on it, and then I'll turn it to you to maybe finish out, is there's a lot of magic math going on right now on the other side of the aisle, right? How do you take a group of people who both want to cut Medicaid in a devastating way, want to cut other health care in a devastating way, and match them up with a bunch of people who say, I can't, colleagues on the other side of the aisle who said, I can't accept cuts like that? How do you balance two completely different factions in the same party? And it happens, right? What normally we would see is tough choices being made, right? Either the other side of the aisle is going to acknowledge we have to make these devastating cuts, or they're not going to cut them. But what we see now is the third secret option, which is magic math, which is we're going to tell you we're not cutting anything, but we're going to quietly make the math just work so that we are actually cutting all these things. We are able to reap the benefits, or we push those cuts out to the out years, right? So you don't notice them today, but maybe later, maybe after other elections, you're going to feel those Medicaid cuts. So it's just my big warning label on the whole story here is that there's magic math going on from beginning to end on this package, and don't be fooled. They are coming for your health care. You are either going to be paying more or you're going to lose your coverage. That's just a fact based on the math that they've put out publicly and voted on today. So I thank my colleague for the opportunity to do my first colloquy. I didn't know this was a thing that we could do. Thank you for giving me that opportunity, and I'll let you finish us out.
Thank you, from great senator from Michigan. Let me say I'm so pleased that she brought this up, because it is a gimmick. The gimmick that they're playing right now is somehow that these $7 trillion in tax cuts that they want to give to billionaires is not going to add to our deficit or debt. Remember, these are the Republicans, the party of fiscal responsibility. and it's not going to add to our deficit or debt. This is a perfect example. I read this in the papers. Perfect example of what this means. This is like you're a parent and you have put your daughter through college for 4 years. And she comes home and she says, oh, well, it's not gonna, you're already paying for it, so it's not really an additional cost to you. So I'm just gonna stay home and not work, and you just continue to pay the same amount that you were paying for college, and I'll just live off of that. It was a great example one of our papers put out, as a journalist put out, because that is exactly what the Republicans are trying to do here. This is it. And remember, they are next going to come and try to lift the debt ceiling, more debt to pay for this. This is the party of fiscal responsibility. At a time, think about this, at a time when our economy is already in a free fall because of these crazy tariffs. And by the way, if you care about your retirement and your 401k, you're watching that stock market because that's in free fall. That's what this administration, that's what these Republicans are bringing you. But remember, when they started, they got handed an economy from the previous administration that was going strong, that had just come out of a pandemic, was trying to turn everything around. Was it perfect? No. But we were working on addressing the challenges facing this country. I know my colleague from Michigan knows this. Our families' prices are too high. Costs are high. We got to focus on them. We got to lower those costs. These tax cuts should be about them. More money in their pocket. We started doing that around health care, capping the cost of insulin, making sure that those big pharma companies, they would negotiate with us and we can keep those prescription drugs down. We started that process. We have more to do. I know that. But when President Trump came into office, the first thing he said, he was going to lower those costs for our families. That is not his priority, and that's not what he's doing. And that's why we have to shine a light on this. And that's why I'm so proud of my colleagues for standing up and making sure the American public knows that they're coming after your health care, and they're coming after your retirement, and they're coming after you so that they can pay for these tax cuts for billionaires. With that, Mr. President, I yield the floor.